may sound crazy, but a new study suggests men who smoke pot could experience enlarged breasts. And Dr. Mahlon Kerr with Synergy Plastic Surgery has helped patients deal with the problem and is here to explain it. Good morning.
Good morning.
Now, this actually has a name, the condition.
Gynecomastia is what it's called, but people call it man boobs as well.
And so, brand new study out. Hadn't heard of this before.
Yeah, it's something that I think as we see the popularity of marijuana use increasing with Colorado and Washington legalizing it, we're also seeing in the plastic surgery world potentially an increase in this condition. And so gynecomastia is thought to be related to a reduced amount of testosterone in the body. And we know that people who are heavy marijuana users also have reduced testosterone. And so it's become something that as plastic surgeons, we're now asking our patients, you know, if other causes have been ruled out, you know, there's not a tumor or sometimes people can just carry extra fat in their chest. If they have no causes at all, I'm asking, you know, are you a marijuana user and how much are you using?
And if you're sitting at home saying, you know, does this really happen? I mean, you just did a procedure yesterday. Yeah,
so the gynecomastia is very common. So if you look at men between the ages of 25 and 45, it's about 30 to 40% of those men will experience some condition or effects of gynecomastia. However, as men age and get 60 years and above, we're looking at almost 60% of men having some form of gynecomastia, which is really just a swelling of the breast tissue that we're not supposed to have.
Of course, we do have proof that you did that procedure yesterday. You provided some video for us, but we decided if you're eating breakfast, it's probably not a good thing to show you right now. But we do have this before and after picture of someone who underwent the procedure.
Right, and you can see that there's a definite improvement in the contour. It's a very easy operation to do. The operation that we did yesterday, the man was awake the entire time. He only had a mild sedative, and it's basically liposuction of the chest. It has to be done using a specific type of liposuction where we use a high-frequency ultrasound to break up the gland because it is very tough. But men experience, I think, a very nice result, and it really only takes less than an hour to do.
More about this study. Is it a high use of marijuana? Have you done much research on the study itself?
So if you look at the numbers, the complete conclusive evidence in people is not 100%. But if you look at laboratory studies, it's definitely shown that exposing laboratory animals to high amounts of THC causes that decrease in testosterone. We know that it affects sperm motility in men. We know that testosterone levels decrease. And if you look, the NIH actually, you know, clearly states that gynecomastia, one of the potential causes, marijuana use.
Got it. So this study could curb the use of pot.
It's possible. We'll see. I think on a side note, it'll be interesting to see that these states that are decriminalizing and are legalizing marijuana, you know, will the plastic surgeons who work in those states, will we see a rise in the amount of chest contouring that's done and the number of people who are coming in for gynecomastia?
Yeah, definitely something to keep an eye on. Thank you, Dr. Kerr, for coming in this morning on such an interesting topic.
A pleasure.